India. So I really like to know what exactly when you go to the surgery, are you doing on your own, or the professors are letting you to do? What is the system over here? You would like to know?
I'm afraid, I haven't think like I will do surgeries. I will be in the post graduation in the surgery department. From childhood onwards, I'm afraid of surgeries. Even wearing glove is too difficult for me. But Laul also, he said, no problem, you can do, but you have to little bit more confidence. Without confidence, you can't do anything. You have to be confident and more learn slowly and practice like every day. You can do anything, like he said, and he gave me like more boost to my to my heart to feel like how to feel like surgeon, how to feel like doctor, more professionalism. Like he taught me like that. After that, first of all, I used to wear like just I used to help them like pulling retractors, like some third assistant job. And after that, after my improving skills, he gave me like okay, you do first you learn like disinfecting body, and after that scarf we have to put scarf.
Yeah.
So many he taught me many things like if you want to be a surgeon, you have to be perfect in these things. Learn slowly, no problem. Yeah, sometimes I used to do mistakes, but he said rectify your mistakes and then you will be a good surgeon. He gave me more strength to my heart. And
Thank you.
Afterwards, like even though I don't know like how to make sutures and how to make knots, how to make ligation, how to use hemostats, like equipments, like surgery infrastructures. He taught me like use like this, use like this. It's a honor to be his student. He's a good teacher.
Chetanya is the study with heart. I always talk with the doctors, teachers, nurse, and the Chinese very frequently. Yeah.
I'm very happy to know about that you are teaching our Indian students, and I would like to know, Mr. Chetanya or Dr. Saab, how much time you have taken. What is when you joined this college in LMU Medical University? Each year you have joined here?
2010. As soon as I finished my MBBS, I came here.
Okay. So now, you can do your sutures on your own?
No problem.
So every day, or you are attending the hospital. So how many sutures you are making for how many patients you are doing? So what is in weekly at least how many sutures you are making or something like that?
It's like countless.
Yeah,
I haven't counted like every day, maybe 3 or 4.
Maybe 3 or 4.
Maybe 3 or 4, but like I haven't count like how.
Yeah, because the Indian surgeons who want to be surgeons in India, who want to be surgeons in India, because it's very difficult to get a postgraduate entrance test in India. So they would like to come to China for developing their skills. So they want to know how many sutures they can make it and how many operations they can attend as of third assistant. After that, second assistant. They want to know from third assistant to come to second assistant how much time it will take, and from second assistant to first assistant they want to come how much time it will take, and then to really assist a professor how much time it will take. Can you please explain them so that we can get some Indian students to come here to study the surgery over here, because in India it is very tough to get a seat for surgery, because more than I can think 50,000 students appear for entrance for PG, and we have not more than 1,000 seats. 49,000 students want to become a PhD but not able to become. Only 1,000 students are able to become. It's so difficult in India. So can you please express how much time it will take? From 2010, how many months you have worked as a third assistant, and after that, how many months you have worked as a second assistant? Now, what is your capabilities? What are the operations you have experienced, and what are the tough time you have experienced in the in the operation theatre? Your personal experience.
surgeon job is not easy.
Right.
It takes so much, so much patience, so much waiting. To become a good surgeon, you have to be wait for the good chance. And Laolos gave, Laolos give me that chance. I waited so much time to learn how to make one step forward. From at beginning, I'm third assistant. Like so much patience for the retractors. So much standing. Like about per a day, I used to be like third assistant, like 4 operations. When I came, I used to come like 6:37 in the morning, and maybe 6:37 in the evening. I used to get on from the job, and I used to go home. It's not easy, but after my seeing, so like I'm passionate about the learning things. Laolos gave me he said, you working hard. Maybe he should done. He deserved to be a best. He deserved to learn something, like by seeing his hard work. He used to see me like that. No one believes me what I can be, but Laolos believe me, like you can be a good surgeon because you are working hard. He said, okay. I took time like 6 to 7 months. 6 to 7 months. Before that, I only like scrubbing and wearing gown and wearing gloves. Like every part of the surgery, you have to be like self-experience. Without knowing each part, you can't be a like head. You can't be a good surgeon. You have to know how to wear a gloves, or how to wear how to wear gown in proper way, like sterile. Scrub means sterile. After scrubbing, you have to don't touch anything. Sometimes I used to like in the tents I used to do mistakes, but in what we say in many surgeries I have to rectify my mistakes. It took my like 6 to 7 months to be like perfect third assistant, and to be like second assistant means I used to disinfect body and scarf. Like it's about like 1 year to learn. Like Chinese are like if they believe in you, they will give. If they won't believe in you, they won't give a chance. Like they are afraid. Like if he do mistakes, if he don't know the language, how can he rectify his life? It's like it's about like 1 year to be like the second assistant, and afterwards if we put one step forward, it won't be like burden for us to again put another step forward. So good. I have been like so many surgeries, and after that 1 year, at least like 1.5 years, 2 years, like to be like second assistant, and after that within this during period. He used to like learn how to switch, how to make a knot, perfect knots, like with right and left hands. Because a good assistant we won't take too much long time to make a knot. Like he's like so much smart, so much smart in the surgeries. Sometimes we used to only 2 of us used to go surgeries for with the help of only one assistant. It's like astonishing. ఆశ్చర్యం వేసే చూడడానికి ఒక్కడు ఎలా చేయగలడు within one man show. How he taught me how is like one man show in the surgery.
So Mr. Chetanya is saying that Mr. Laolos used to go with the Dr. Chetanya Rao in the operation after developing his skills. Slowly after 1 year, the third assistant allowed him to do surgeries. Both of them, when other doctors are busy, they used to go together and have operations. So please continue. What is next step? What you heard?
After billing in me, he said like subcutaneous sutures, like they are like only not like there less layers of skin, like skin, subcutaneous, and like muscles and so on. Like to make a subcutaneous, they are like skills. They are not easy. They are not easy. I took like 2 years to make my perfection in that. Now he praised me like no, you became a good like master in doing sutures, in subcutaneous sutures. You are like me. You are like me. He said. I said no sir. You taught me. You are the best, and then I might be second best, but you are the first best teacher. You who taught me what I am, and who taught me to become like good person. And now I can be now I'm pretty much confident. I can do if anything like anybody like assistant to me to just like me to make like perfect guy. I can be like I can do surgeries.
So Dr. Chetanya Rao, are you confident if you go to India, can you perform a surgery on your own? What do you learn in China with Liaoning? Are you happy with that? Can you please tell our surgeons?
Yeah, I'm pretty much happy and I'm pretty much confident. I can do.
You can do surgery. So what type of surgeries you can do? Can you please express?
Yeah. I'm pretty much confident about thyroidectomy and varicosis, and yeah, these are 2 surgeries I can do, and I went to another departments also, like neurosurgery.
Okay.
Neurosurgery department, and in neurosurgery I used to like in outpatient department they used to like circumcision of penis, and again like hydrocele. And they taught me like so I can pretty much confident.
Okay. So Mr. Dr. Chetanya Rao is saying that he can perform his own operation if he is having assistants in thyro surgery. You say thyro and whatever other surgery you say. Neurosurgery, thyro surgery, and varicosis surgery he can perform on his own if he have assistance in India. So I'm very happy that our surgeon Mr. Liaoning is helping our students, Indian students over here. I appreciate it on behalf of Medico Abroad, and then appreciate him that if our students from India come, and then he will help our students, our doctors, as he helped our Chetanya Rao. I'm really thankful for Liaoning to give us so much of time, and appreciate his skills, and then I appreciate his what is
always the cheap. Yeah.
Oh, okay, Chetanya Rao. Yeah, please we put a photograph like this.
Yes, earlier.
Mr. Chetanya Rao here. Sir, please come. You are